Hello everyone. Everyone experiences sadness and unhappiness at some point of their lives. But clinical depression, however, is more intense and of longer duration than typical sadness or grief, which interferes with the person's ability to engage in any daily activities. Depression is a common illness worldwide, with more than 264 million people affected. It can cause the affected people to suffer greatly and function poorly at work, at school, and in the family. If left unattended, it can lead to self-isolation and to become entangled in feelings of guilt or helplessness, which can lead to extreme situations. And at its worst, depression can lead to suicide. Depressed emotions can occur due to sad situations or memories. But if it's difficult to control these emotions on your own and it interferes with your daily life, appropriate improvement is necessary. Hi there, Ume from Cloud Hospital TV, and today in this video I'll discuss everything related to depression. But before I start, please subscribe to our channel so the next time you'll be updated with our new releases. Depression, major depressive disorder, is a common and serious medical illness that negatively affects how you feel and how you think and how you act. Depression causes feelings of sadness and or loss of interest in activities you once enjoyed, leading to a variety of emotional and physical problems with decreased ability to function at work and at home. According to the World Health Organization, depression is the leading cause of disability worldwide. And if left untreated, we must know that depression is one of the major risk factors for suicide. Depression is different from sadness or grief. The death of a loved one, loss of a job, or the ending of a relationship are difficult experiences for a person to endure. It is normal for feelings of sadness or grief to develop in response to such situations. Those experiencing loss often might describe themselves as being depressed. But being sad is not the same as having depression. The grieving process is natural and unique to each individual and shares some of the same features of depression. Both grief and depression may involve intense sadness and withdrawal from usual activities. Distinguishing between grief and depression is important and can assist people in getting the help, support, or treatment they need. Now, the symptoms of depression can be different in men than in women, as well as in children. Let's start with symptoms in female. Women are more likely than males to suffer from depression. Symptoms of depression in women can include irritability, feeling empty or nervous, slower movements or reaction, decreased energy and fatigue, also known as brain fog, weight fluctuation, headaches, problems sleeping, early awakening, and difficulty making decisions. They also tend to prefer to withdraw from social activities and engagements. Some sources suggest that depression can cause skin problems such as psoriasis. Also, sometimes thyroid problems can trigger depression. Now let's talk about symptoms of depression in men. Men may suffer from more stigma around depression due to the society expectations of being strong and not showing emotions or signs of weakness. Depressed men experience symptoms such as restlessness, anger and aggressiveness, feeling hopeless or sad, no longer being interested in activities, excessive drinking, drug use, reduced sexual desire, difficulty completing tasks, delays in responding in conversations, excessive sleepiness, insomnia, fatigue. Men can also experience some of the physical symptoms women experience. Also, it was found that they experience more digestive problems and difficulties in sexual performance. Depression in teens and kids. Unfortunately, depression also affects children and teens. Feelings of incompetence, despair, and intense sadness may be more prevalent among them. Also, a decline in school performance can indicate that a teen is depressed. Some children or teenagers are considered to be lazy, and it's important to note depression signs and not dismiss them. Other signs are social withdrawals and emotional outbursts. If left untreated, depression can result in the illness getting worse and persistent into adulthood. Depression types. So depending on the severity of symptoms, depression can be classified as major depressive disorder or persistent depressive disorder. Major depressive disorder, also known as MDD, is the more severe type of depression. Major depression, clinical depression, has intense or overwhelming symptoms that last longer than 2 weeks. These symptoms interfere with everyday life. Persistent depressive disorder, PDD. Persistent depressive disorder is a milder but also chronic form of depression. PDD is also known as dysthymia. Symptoms of the PDD are less severe than major depression, but people experience PDD symptoms from 2 years or longer. Depression can be present in bipolar disorder. People with bipolar disorder have alternating periods of lower mood and extremely high energy, maniac periods. Seasonal depression or seasonal affective disorder usually starts in late fall and early winter. It often goes away during the spring and summer. This disorder is more present in younger adults than in older ones. Perinatal and postpartum depression can occur during pregnancy and up to 1 year after having a baby. Postpartum depression is more about the hormonal imbalance and an unfortunate consequence of giving birth. Symptoms go beyond the baby blues, which causes minor sadness, worry, or stress. Premenstrual dysphoric disorder is a severe form of premenstrual disorder, PMS. It affects women in the days or weeks leading up to their menstrual periods. Depression is caused by the complex interplay of social, psychological, and biological variables. People have experienced adversity in their lives, such as unemployment, bereavement, or psychological trauma, are more prone to develop depression. Depression in turn can lead to increased stress and dysfunction, worsening both the affected person's living condition and the depression itself. Some of the neurotransmitters that play a role in depression are acetylcholine, that enhance memory and play a role in learning and recalling information. Serotonin, which helps regulate mood, sleep, and appetite. Dopamine, which is essential to movement and motivation. Norepinephrine involved in reward and can trigger anxiety that usually comes with some forms of depression. Depression and physical health are linked. For example, cardiovascular problems can lead to depression and vice versa. So how is depression syndrome diagnosed? Everyone may feel sad or down from time to time. However, clinical depression has more intense symptoms that last 2 weeks or longer. To determine whether you have clinical depression, your healthcare provider will ask questions. You might complete the questionnaire and provide the family history. Your healthcare provider might also perform an exam or older lab test to see if you have any medical conditions. Depression treatment. There are effective therapies for both moderate and severe depression. Healthcare professionals may provide psychological therapies such as behavior activation, cognitive behaviors therapy, CBT, and interpersonal psychotherapy, IPT, that is effective for mild depression. Prescription medicine called antidepressant can help change brain chemistry that causes depression. Antidepressants can take a few weeks to have an effect. Examples of antidepressant drugs include selective serotonin reuptake inhibitors, SSRIs, and tricyclic antidepressants, TCA. Some antidepressants have side effects, which often improve with time. Alternative treatments for depression. People with mild depression or ongoing symptoms can improve their well-being with complementary therapy. Therapy may include massage, acupuncture, hypnosis, and biofeedback. There was a lot of evidence that says exercise can help in depression, and even just walking and breathing every day can help. There are some supplements that can help with depression, like vitamin D or B or omega-3 fatty acids. Depression is real pathology that should not be overlooked, especially by family and friends. If you want to take care of someone struggling with this condition, do it in a gentle way and don't suffocate him. Find places where he can get help or ask him to do pleasurable activities together. If you think you suffer from depression, find the professional help you need. As shown above, there are plenty of options. Thank you for joining us in yet another video covering key health-related topics with God Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.